Canada has signed an agreement with Moderna for 20 million doses. Joining us with a Canadian exclusive interview is Zaks. He is Moderna's Chief Medical Officer of Health. He's in Cambridge, Massachusetts, where Moderna is headquartered. Dr. Zaks, thanks so much for taking the time. Really appreciate it.
Pleasure is mine to be here, Todd.
You know, first off, congratulations, because that number, 94.1% efficacy, is just a game changer, is it not?
We believe it is, and we believe it portends well for our ability to change around the pandemic. And I think the salient point here is not only is this a high point estimate for the ability of this vaccine to prevent disease, it actually was conducted and it was shown in a trial that is truly representative of people who are at risk, older individuals, people at risk for severe disease, minorities, people with comorbid conditions. And if you look at the data closely, we actually had 30 cases of people who came down with severe COVID-19. These are people who need oxygen, need to be in the hospital. Unfortunately, there was also one fatality among them. All of these cases occurred only in the placebo arm. We did not see a single case of severe disease on anyone who received our vaccine.
100% effective at preventing severe cases as well. I mean, it's very significant.
That's right. And so we're now turning our attention to the impact that we anticipate this will have on the shape of the pandemic around us.
The process for emergency use authorization from the United States and Europe, can you tell us a little bit more about what that's going to involve now?
Yeah, so in the United States, it's a two-step process in the sense that we submit for an emergency use authorization, but the data, this is the final analysis in the sense that this was always the primary endpoint, and we believe these data will allow us to obtain a full licensure. The emergency use authorization is a way that the FDA has established as a pathway to quicker access while we conduct all the proper diligence and paperwork over time to put the full file in front of them. And so we anticipate that within the next 2 weeks, likely on December 17th, we will be presenting the full data in front of the FDA's expert panel, the VRBPAC Advisory Committee. And my hope is that shortly thereafter, FDA, with the appropriate CDC recommendations, will provide us the emergency use authorization. Now, outside of the U.S., the pathway is similar in the sense that we are able to take these data and submit simultaneously for global regulatory authorities to receive marketing authorization. And indeed, we have submitted that same file in several countries. We've gone to Europe today. Within the next few days, we'll be submitting the same package to Canada, to Israel, Singapore, and all the other locations where we've made commitments to supply vaccine.
So speaking of our regulators here, Health Canada, when will they get a look at your findings? Is that happening in the next couple of weeks?
Oh, it'll happen within days. So they've already started to look at our data. We've had a close collaboration with them as well, and they're well aware of our data, both what we've shared so far in terms of the earlier trials, the manufacturing standpoint, as well as now the final data. They should expect to see it very shortly.
And Dr. Zaks, can you get this vaccine and still possibly be a carrier of the virus, passing it on to others, or just sort of in layman's terms, what exactly does this mean?
So that's a great question. We don't yet have data that can demonstrate the ability of the vaccine to prevent what's called asymptomatic infection. So people may be harboring the virus but not developing symptoms, and there's still a risk of transmission. We won't know that for a while. Some of that information we will see based on blood work from this trial that will take still several weeks to analyze, and some of it we're going to have to study in the future. For now, what we can definitively conclude is that this vaccine can prevent symptomatic disease and indeed severe disease from the virus.
You know that Canada has purchased 20 million doses, and of course that number could be increased, but it's become a little bit of a political hot potato in our country. Some are accusing our federal government of being at the back of the line when it comes to vaccines. I'm wondering whether you can help to clarify when you think Canadians realistically can expect to start getting doses of the Moderna vaccine.
So I believe Canada has actually opted for more than 20 million doses. I'll go back and confirm with my team, but the number that I have in my head is actually larger. I don't think Canada has been at the back of the line at all. I've seen the Canadian experts and regulators do what everybody across the globe has been doing, which is to look at the various vaccines as they have been demonstrating first the potential, then the phase 1 data, and now efficacy, and make sure that Canadian citizens are protected. We've been working very closely with them, and I anticipate that as soon as our manufacturing supplies for ex-US ramps up, and that's realistically going to be in significant quantities only in the beginning of 2021, that we will start to be able to send that vaccine to Canada as well, of course, pending regulatory approval.
Okay, so just to clarify, the vaccine, the manufacturing gets ramped up in early 2021, and that's when Moderna would start to ship to countries outside of the U.S., including Canada.
So manufacturing has already been ongoing. We have been expanding that capacity and accelerating it to the best of our ability for several months now, starting back in the second quarter of this year. The first amounts to roll off the assembly line, so to speak, will happen towards the very end of this year, beginning of next year. Significant quantities, that's first quarter of next year.
And I'm just curious if you can illuminate how it works in terms of, the United States getting its doses versus other countries, and sort of, who is in front of whom.
So the United States has stepped in and invested a very significant amount early on in this year to ensure that there is a scale-up of the manufacturing capacity domestically, and hand in hand with that to ensure that its citizens are first in line. And so the manufacturing capacity in the United States paid for in terms of the acceleration of that capacity and the scaling up supported by the U.S. government from early on in 2020 has been designated for the United States. We have then in parallel turned around and invested our own capital in infrastructure, a partnership with Lonza, and manufacturing to be stood up ex-US. This is coming primarily out of Switzerland and Europe. And we anticipate that those supply chains will then be the primary way to supply outside the US, at least in the beginning of 2021. Now, as more supplies come online, I anticipate that we're going to be able to shift the supplies that we have, even from within the U.S., once our commitment to the U.S. government is fulfilled, to support the global need in this pandemic.
And how does the rollout actually work? So you fill the orders, and then is it the responsibility of various governments, including the Canadian government, to get it out there and make sure that, can you just walk us through that process?
Yeah, I think that's right. I think that in the context of a pandemic and such an overwhelming need and demand, we are going to rely, both as a company and as citizens, as private citizens, on our governments to determine who should get this first when supplies are limited, and ensure that the infrastructure is there to actually deploy. So our commitment and the way we've been working has been directly with governments. And in that regard, our commitments and our deals are to supply the governments. And then at their direction, we distribute it to the distribution centers that they designate. And beyond that, I think we're going to have to rely on local health authorities to ensure that the population who needs it the most is in the front of the line and has access.
In a best case scenario, how much vaccine can Moderna produce in 2021?
We're currently looking at up to 1 billion doses in 2021.
And I also know this has been very emotional for you because the stakes are just so high and all the pressure. What's it been like on a personal level, Dr. Zaks?
It's been fascinating. It has been a roller coaster. I've had a very high expectation for efficacy from the moment that we saw the phase 1 results. And frankly, those of us who've been close to the platform, I don't think have been surprised, but there's a mixture of a sense of responsibility and a sense of relief that indeed this is so effective. I can tell you when we saw those first interim results back a couple of weeks ago, there was a sense of celebration and relief that indeed the path has been paved. When the results came in a tad earlier last night, or the night before we were expecting them, I can tell you for the first time I actually allowed myself to cry. The emotional impact of understanding what we've achieved already If you look at the trial results, the avoidance of all severe cases, understanding that we're already saving lives even within the context of this trial, and now you look around us at the way this has impacted people in terms of sickness, in terms of mortality, in terms of society, and just then translating in your own mind a vaccine that can prevent 94% of that and maybe all of the severe cases, and you superimpose that on what's ahead of us in store from this pandemic, if we can't turn it around with vaccination, that can get overwhelming.
Yeah, just an astonishing timeline as well to think that we first figured out this virus was there about a year ago, and now we're at this point, Moderna and others. Are you planning to take it? Will you give it to your family, Dr. Zaks?
I cannot wait. So my mom is abroad. She's 80 years old. My family is here with me. We're going to try to get in the front of the line, and certainly we're all looking forward to receiving this vaccine, absolutely.
Dr. Tal Zaks, listen, thanks so much for taking the time for us in Canada. Very much appreciate it.
It's been a real pleasure talking to you today. Thank you.